Hi. Hi. Here for the following minutes or what? So I'm at work. So y'all about to be mad because I'm mad because my lighter off. I don't like this background and all this shit. Okay, I'm at work. Gross. All right. So I'm gonna be moving my fine ass from the scene, but I'm here and I'm queer. So don't think that I'm not here because I am. I'm in the building. But yeah, so I'm at work. Y'all know I'm a badass bitch. I'm a multitasker. I do big things. So I'm definitely here and we're gonna get into some stuff. As you've seen by the title, welcome, 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 SeanDavieWay. As usual, like, subscribe if you haven't already. Hi. So yeah, I will be back on Sunday with Sean Sunday. So make sure y'all come through on Sunday. I'll be there. We're gonna be having some fun. We're gonna be singing. We're gonna be doing our thing. So make sure y'all come through with some songs and whatnot. And yeah, come have some fun with us. So hair flip gross. Yeah, so I've been telling y'all I was going to give you guys a Corona update, a COVID-19 update. So I'm going to give y'all like a real update, like I don't know what these other people, what y'all been listening to, but I've been listening to some stuff, but I listen to facts and then I go do my research. Like I tell y'all, go do your own homework. Don't just believe what people say. Like, don't just take that shit. All right. So, yeah. So upon doing my research and whatnot, I mean, like I've been saying from day one, I feel like this Corona thing is serious, but still at the same time, I question a lot, that comes to it because a lot of this shit just doesn't make sense. So, that's what my thing is. I want to make sense of what's going on. I don't want to, make it more stressful or make problems or anything like that. But I do feel that we need to pay attention and we do need to worry about what the fuck they doing to us and what's going on. So, upon investigation, y'all know I love to go to the Europeans, and Fox News, they came out with this article, and I felt that this was definitely something we need to pay attention to. So, Burks says government is classifying all deaths of patients with coronavirus as COVID-19 deaths, regardless of cause. So basically, what this article is saying, long story short, I'm gonna get into the article, but what it's basically saying is that it doesn't matter if you have COVID-19 when if found dead or some on the way to die, something like that, and somebody says you have COVID, no matter what, that's what your death is going to be classified as. So if somebody shot you, if you was hemorrhaging, like a heart attack, if you're diagnosed with COVID, if you have COVID, that's the reason you died. That's what's going to go on your death certificate. COVID-19. All right. Not died to heart attack, not cardiac arrests, none of that. COVID-19. So, yeah, so the federal government is classifying all deaths of patients infected with the coronavirus as COVID-19 deaths, regardless of the underlying health issues that could have contributed to the loss of someone's life. Let me read that last part again. Regardless of any underlying health issues. So if you've already had a health issue, diabetes, like it just doesn't matter. Like leukemia, it just doesn't matter. Whatever issue you had before this virus, all that matters is that you had this virus and that's the reason you died. Not because of an underlying health issue that you had prior, just because since you had it, your ass died. Yeah, that's what you died from. So Dr. Deborah Birx, the response coordinator of the White House coronavirus task force, said the federal government is continuing to count the suspected COVID-19 deaths, despite other nations doing the opposite. Okay, so everybody else doing the opposite. What the fuck we know, but whatever. There are other countries that if you have had pre-existing conditions and let's say the virus caused you to go to the ICU, intensive care unit, and then have a heart or kidney problem, she said during the Tuesday news briefing at the White House, some countries are recording that as a heart issue or a kidney issue, not a COVID-19 death. Some countries are reporting that a heart issue or a kidney issue and not a COVID-19 death. All right. The intent is if someone dies with COVID-19, we are counting that. She added. Asked whether the numbers could skew data the government is trying to collect, Burke said that most would apply more to rural areas where testing isn't being implemented on a wide scale. I'm pretty confident, this is her quote, I'm pretty confident that in New York City and New Jersey, in places that have these large outbreaks and COVID only hospitals, I can tell you they are testing, she said. Basically, so we know in these areas that they test, so we can count these as actual COVID victims. So the other areas, they like she said, above in the other countries that they aren't testing for it, basically saying that if you come in and you die because of a heart issue or a kidney issue, that's what the hospital writing down that you died of versus the testing you to see if you had COVID-19 or not. So it's like, if that's what you died from, that's just simply what you died from. Okay? Like, how you just gonna force me to have died from COVID-19 when I died due to a kidney or a heart issue? But whatever. All right. Dr. Michael Baden, a Fox News contributor, said it's reasonable to include the death of someone infected with the virus who also had other health issues in COVID-19 body count. In normal course, autopsies would then determine whether the person died of the effects of COVID virus, whether the person had a brain tumor or a brain hemorrhage, for example. That might be unrelated to it, and the relative significance of both infection and pre-existing disease is. However, the number of autopsies being performed could be low due to the danger of infection, he said. Then you would include the numbers of the people who have had a pre-existing condition and that have had caused death anyway, but that's probably a smaller number, Baden said. So basically, long story short, is what he's saying right here is that it don't matter if somebody poisoned you. It don't matter if there was a whole bunch of shit that shouldn't have been going on and the reason to why you died. Basically, if COVID-19 is connected to you, they're not even performing autopsies on people. If you are listed as a person that tested positive for COVID-19 and they push your body back there, they basically just throwing your ass inside of a gurney instead of burning up. So what if you tested positive for COVID-19 and somebody poisoned you? Or you tested positive for COVID-19 and somebody stabbed you? Like, I mean, are you even going to look at my body? If my body was just found, are you even going to look at it? Or are you even going to just like, what? Like, are you kidding me? So that is the only thing that pissed me off, because I'm just like, okay, well, this is crazy, because now y'all basically just forcing the numbers. So how do you actually know if these people are dying due to the virus or if they're just dying due to natural causes? And the number is going up so high to where every time you look up, 11 people died, 20 people died, 30 people died, because, and the number just like each hour, just keeps getting higher and higher and higher, because these are natural deaths. Because it's like, where are the natural deaths? Are those no longer being counted? Are we no longer counting natural deaths? Like, because I'm super confused. If a person has an asthma attack and died from it, is that corona? Is that COVID-19? Or did they just die because they had an asthma attack and they didn't have an inhaler or, anything around, not a method to calm themselves down to where they can go back to normal breathing? So it's just like, because if you have COVID-19, they basically not even opening you up. They're not even trying to figure out your cause of death. If you have COVID-19, they're basically just stamping it as you died due to COVID. What if you didn't? Like, weird. Like, I'm like, that is insane. Now, here's another article that pissed me off. Now, shout out to Vox. Oh, wait a minute. Hold on. What's going on? Wait a minute. Europeans. Okay. The Trump administration blames COVID-19 Black mortality rates on poor health. It should blame its policies. Okay. So the administration policies have exacerbated the health conditions that are leading to more coronavirus fatalities among Black Americans. Trump administration officials, including President Donald Trump himself, have increasingly begun to recognize the fact that Black Americans are dying of COVID-19 at a greater rate than Americans of other ethnicities. I'm fine. I ain't coughed, snuzzed. Okay. But in attempting to explain why, the president and top officials are taking a narrow view of the problem, and one that ignores many. The Trump administration has helped Black Americans uniquely vulnerable to the coronavirus. We're seeing tremendous evidence that African Americans are affected at a far greater percentage than other citizens in the country, Trump said at his daily coronavirus press conference Tuesday. But why is it that the African American community is so much the numerous times more than anybody else? We want to find that reason. All right. Three administration officials, the director of National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci's Secretary of Housing and Urban Development, Ben Carlson, and Surgeon General Jerome Adams gave the same hypothesis for this why is on Tuesday, whatever, that the health of Black Americans is worse than the other health of Americans. Okay, so their hypothesis is that the health of Black Americans is worse than the health of other Americans. One of the things we know in the African American community, there is a higher incident of hypertension and a higher incident of diabetes, asthma, and many other underlying conditions that associate with a higher mortality rate. So all of the things that they just mentioned right here are the same things that they're not counting when people are dying now. So if you have had diabetes, if you've had asthma, if you had hypertension, none of those things matter right now, because if you're diagnosed positive for COVID-19, that's what you died of anyway. So how would any of this make sense at all? How would any of this be on the data? How would you even be able to even consider this as data? One of the things we know in African American communities is there is a higher incidence of hypertension, a higher incidence of diabetes, asthma, and many other underlying conditions that we associate with a higher mortality rate. Now let's go back real quick to this article right here that we just read about, the COVID-19, and how they're, naming it regardless. Right here. There are countries that if you had a pre-existing condition and say that the virus caused you to go to the ICU and then have a heart or kidney problem, she said during a Tuesday conference, that Burke's bitch, conference at the White House, some countries are recording that as a heart issue or a kidney issue, not a COVID-19 death. So other countries are doing that. We're not doing that. That's not what we're doing. We're not counting it as that. If you had any of those issues, none of that matters because they're still counting it as COVID-19. The intent is if someone dies with COVID-19, we are counting that. So if you've had an underlying or pre-existing issue, it doesn't matter if you test positive for the virus. So no matter what, if you have COVID-19, your body is basically like you just like it you just don't matter anymore. Basically, it's like you're considered a body. At that point, you're no longer considered a human. Because it's just basically like a matter of time before you either spread it or just a matter of time before you die. So I'm just like, because that's how they're treating people. When they're coming in for COVID, they're not. You got COVID, they're not even doing autopsies on you. Your body just going on back to the burner. You getting cremated whether you requested to be cremated or not. They're just getting rid of you. Like wiping you pretty much from existence. They're literally just blaming it. So let's get back to this article about, Black people, having such, a low mortality rate, so that's why we're just falling like flies, apparently. One of the things we know in the African American community is there is a higher incidence of hypertension and a higher incidence of diabetes, asthma, and many underlying conditions that we associate with a higher mortality rate. Carlson told Fox News. Diana Perino, I think that's her name, Tuesday. It is one of the reasons that we really need to concentrate seriously on the particular population when it comes to health in general, because it will exacerbate anything that comes along, including something like this virus. All right. Now, did you hear her? Concentrate seriously on this particular population. All right. Yeah, because that's who you get. Yeah, that's who the fuck y'all trying to infect us. Fauci gave the same assessment during the press conference and added, "We're very concerned about that. It's very sad. It's nothing we can do about it right now except try and give the best possible care to avoid those complications. In the immediate future, this is true, but there are things the Trump administration could do now and could have done during its first 3 years in power to broadly improve health outcomes for Black Americans and to reduce their risk of dying due to the virus. All right. All right. As of Tuesday, Black people made up 30%, 33% of the cases in Michigan and 40% of the deaths. Despite being just 14% of the state's population in Milwaukee County, Wisconsin, where Black represent 26% of the population. They made up most of half of the country's 945 cases and 81% of its 21 deaths. According to the ProPublica report in Illinois, Black people make up 42% of the fatalities. And y'all trying to make me believe, hair flip, that y'all not targeting these people? Are you kidding me? Okay. But make up 14.6% of the state's population. In Chicago, 42% of the fatalities are African Americans in Illinois, although the African American community only takes up 14.6% of the state's population. In Chicago, the data even grew. In Chicago, the data even graver. Black people represent 68% of the city's fatalities and more than 50% of the cases, but only make up 30% of the city's total population. So how is 68% of the fatalities, which is crazy, more than 50% of the cases, but only make up 30% of the city's total population? So you basically only, 7 of the people have the corona? Only 7 of the race? I mean, only 7 of the white people? And then everybody else is Black? Are you serious? Are you serious? Are you serious? I'm like, wait a minute. Like that just doesn't make any sense. Let me read that one more time. So for the people that didn't hear. As of Tuesday, Black people make up 33% of the cases in Michigan and 40% of the deaths. All right. So they make the 33% of the cases are African Americans, and 40% of those 33 cases have died, is what they're saying. So 40% of the 33% have died. That is huge, despite just being 14% of the state's population. So if that 33% turns into the whole 14%, does that mean that Milwaukee will no longer have African Americans in it? Is that what that means? But you're not targeting. Okay. Gross. In Milwaukee County, Wisconsin, where Blacks represent 26% of the population, they made up almost half of the county's 945 cases and an 81% of its 27 deaths, according to a ProPublica report. So basically, there's been 27 deaths in that county, and 81% of it are African Americans. So therefore, what is it, like 20 Black people and like 7, like, okay. Wow. In Illinois, Black people make up 42% of the fatalities, but make up only 14.6% of the state's population. In Chicago, the data grew even graver. Black people represent 68% of the city's fatalities and more than 50% of the cases, but only make up 30% of the cities, not the state. Just in Chicago, they only make up 30% of Chicago's population. But 68% of the people that have passed away have been the 50% of cases that they've had at only 30% of the goddamn population. Make it make sense? Is y'all not paying attention to these numbers? I do numbers. I pay attention to numbers. My brother's kid's mom just had their child, and her mother are both diagnosed with COVID-19, not the baby. Now they're still testing the baby, waiting for the test to come back to see if the baby has been diagnosed with COVID. but my brother's kid's mother and her mom, so the baby's mother and grandmother, both are diagnosed with COVID, and they basically just got to see the baby born and haven't seen the baby since because they can't be around isolation. They're being quarantined. They have to quarantine the parent, the people that have it, especially from the baby. So I mean, that's horrible. I mean, could you imagine? Just having a baby and they just take it, like not because you was doing something you didn't have no business doing, just because what's in the air and what you have, you can't touch your baby. Crazy. People are actually out here going through things. So count y'all blessings. So count your blessings. Now let's get into this, because this is where I just found a short clip of it. But this is the director of the World Health Organization. And this is what he wants to do, y'all. The COVID director says, shout out to the SeanDavieWay show. World Health Organization director says he wants COVID-19 sick family members removed from homes. Now, let me know if y'all can hear this. I really hope y'all can, because, I'm in the ghetto.
Most of the transmission that's actually happening in many countries now is happening in the household, at family level. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner. Movement restrictions and shutdowns and stay-at-home orders can only be made if we have in place the means to be able to detect suspect cases, isolate suspect confirmed cases, track contacts, and follow up on the contact's health at all times, and then isolate any of those people who become sick themselves.
Gross. I'm gonna play that one more time. Let me know if y'all can hear it.
The transmission that's actually happening in many countries now is happening in the household, at family level. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner. Movement restrictions and shutdowns and stay-at-home orders can only be made if we have in place the means to be able to detect suspect cases, isolate suspect confirmed cases, track contacts, and follow up on the contact's health at all times, and then isolate any of those people who become sick themselves.
So, who house you coming in and taking people cheering? So what he basically saying is that, the infections are still going around, and just isolating people and keeping people at home, that's not enough. What we need to do is we need to go inside of people's house and test people, especially the people that aren't going to get tested for COVID-19. And we need to test them. If they're found positive, we need to remove them and safely. How you going to remove somebody? It's somewhere safe, first of all, because hospitals are full. The triages that they're getting in abandoned buildings and buildings that just ain't being used in storage facilities and all type of shit to use for, temporary triage units and stuff for people. Let me find out you're talking about concentration camps. Let me find out you're talking about coming to people's house and moving them into camps. Because where are you going to put them? Like, you think you about to just come in the house and just take my child, if my child is positive for COVID? I'm going to remove your kid and take your kid and place them somewhere safe until they no longer have it? I promise you they ain't going nowhere. First of all, you ain't about to touch one of my kids. Like, touch one of my children. You think you're just about to walk into my home and test us, and then even if you do find the fact that we are positive, you just about to just start removing us and placing us somewhere safe? Would that somewhere safe be a concentration camp? Because they're everywhere in America. Just because they aren't shown, you could Google it right now, and so many of them will pop up and make your head spin. They're everywhere. There are abandoned prisons that are built nicely, and ain't not one person are inside of it. What is that for? What is that for? Let me find out. So if you're going to be removing people, where are you removing them to? Because that was very coy and very, just like how you said it. He said it like it wasn't a problem. Like, oh, this isn't a big deal. We're just coming to your house and test you. And if you're positive, we're just going to remove you from your home and place you somewhere safe, and quarantine you. Like, you can't do that at home, which everybody that's going to the hospital, especially, that's what they're telling people to do. Go home and quarantine. So why would you come and remove me and take me any goddamn where? Like that makes no sense. It sounds like y'all trying to take people places to off them. Because like, what's safer than a person in their own home? Y'all not even taking homeless people off the street that have COVID-19 and placing them in these safe environments that you have. Y'all not even doing that. So what y'all look like coming and taking people that already have somewhere to stay out of that place elsewhere? Where, if not a jail or a prison? Like, where are you taking them to? That makes no sense. And you think you're about to willingly come into my home and take anybody away? And I'm just supposed to just sit back? Yeah, okay. Yeah, that will not be happening. That just sounds idiotic. For you to even say that as calmly as you said it, is like, that's not a problem. Like, I don't know if that flew over some people's head, but it didn't fly over mine. I heard it. Like, I don't trust anything about that. Signing a form and letting your kid or your teenager or your aunt stays with you, or your grandma or your mama or your daddy, and one of them tests positive and they just remove them. Like, no, you're not taking them nowhere. The fuck? And if you are, I want to know where they're going. And especially if you're taking my child, my child can't go nowhere I can't go. If I can't go, they can't go. I don't give a damn you putting them in a room with a padded wall and with a TV in there. As long as I got one, I will sit there as long as they're there and watch. I sleep at the door. But you're not just about to remove my kid. Like, it's just not happening. Like, that is definitely going to be a fight. So let me find out that's why they got these state marshals and, the National Guards and all that. Let me find out that's why they're in certain areas getting ready so they can start kicking in doors and testing people and removing the people that's infected and shooting the ones that's not. Allegedly. Shit. Y'all ain't coming in my goddamn house. Y'all be knocking. That's all I can tell you. You'll be out there knocking. So I was listening to my governor the other day, and girl, they always come for you when you tell them the truth. They don't like that. Mm, 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 They don't like that. They don't like that, but I don't give a damn. So, yeah, they don't like me telling the truth. They don't like that. But anyways, so I was also watching, yeah, because they go, So there are actually states that aren't locked down, y'all. I'm like, let me find out. Let me find out. I need to pack my shit and get on up out of here. And I got 3 days off. So states without coronavirus orders are under scrutiny. Why wouldn't they be? Y'all open? Like everything. And when I say states that are open, I mean everything in these states are open. Like everything. Can y'all hear me? Am I back? Can y'all hear me? Let me know. Can y'all hear me? Let me, can y'all hear me? 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 Can y'all hear me?